Hello everyone, today we're talking about the case of an 18-year-old man with photophobia, redness and blurred vision, or furthermore about iridocyclitis. Iridocyclitis, also called anterior uveitis, is an inflammation of the middle layer of the eye. This middle layer includes the iris, which is the colored part of the eye, and adjacent tissues known as the ciliary body, which is involved in the focusing process of the eye. Symptoms include red, sore and inflamed eye, blurred vision, photophobia, which is an eye discomfort at bright light, small or irregular shaped pupils, headache, and sometimes a dull pain. Iridocyclitis can be idiopathic, meaning there is no obvious underlying cause. 50% of cases are associated with the allele human leukocyte antigen B27. This is a specific protein that is found on the surface of almost all body cells in these patients. Affected people not only have an increased risk of anterior uveitis, but also of some other inflammatory or rheumatic diseases such as chronic inflammatory bowel diseases, better known as Crohn's disease or ulcerative colitis, rheumatoid arthritis, reactive arthritis, which is known as Wright's disease, psoriatic arthritis, and ankylosing spondylitis. It can also be associated with general health problems such as syphilis, tuberculosis, sarcoid, viral, for example herpes simplex, herpes zoster, or cytomegalovirus, or even result from a trauma to the eye, such as being hit in the eye or having a foreign body in the eye. The symptoms of anterior uveitis can be similar to those of other eye conditions. Therefore, the ophthalmologist will diagnose the condition with a slit lamp examination to identify microscopic inflammatory cells in the front of the eye. For this procedure, the doctor may apply a special dye called fluorescent to them to make the exam easier. They will administer this as eye drops or on a small thin paper strip that touches the white of the eye. The doctor will then administer a series of eye drops that will dilate the pupils. The dilation will make it easier for the doctor to see other structures in the eye. It takes about 20 minutes for the drops to work. The patient will sit with his head resting in the slit lamp microscope, and the doctor will place a special contact lens directly onto the eyeball. He can also perform a conjunctival swab or tonometry, which measures the intraocular pressure. If an infectious genesis is suspected, additional microbiological diagnostics for ophthalmotropic pathogens should be carried out. If there's a suspicion of an autoimmune or rheumatic genesis, extensive laboratory diagnostics are necessary. A full blood count gives information about antinuclear antibodies, cytoplasmic antibodies, erythrocyte sedimentation rate, and the C-reactive protein. Complications of iridocyclitis include posterior anterior synechia. Ocular synechia is an eye condition where the iris adheres to either the cornea, which is the case in anterior synechia, or the lens, which is the case in posterior synechia. Developing of a cataract, which is a medical condition in which the lens of the eye becomes progressively opaque, resulting in blurred vision. Secondary glaucoma, which is a damage to the optic nerve. Seclusia pupilla. This occurs when the synechia extends 360 degrees around the pupillary border. And occlusio pupilla, which refers to a membrane obscuring the lens surface. Treatment for iridocyclitis primarily aims to reduce inflammation in the eye and prevent complications. You may be given mydriatic eye drops commonly containing atropine in order to avoid adhesion, as well as steroid medicine. These eye drops dilate your pupils and relieve pain by relaxing the muscles in your eye. They can also reduce your risk of developing glaucoma, which affects the vision. However, mydriatic eye drops can cause some temporary blurring of your vision and problems focusing your eyes. If an underlying infection is causing uveitis, the infection may also need to be treated. Viruses can be treated by antiviral medicine. Bacterial infections can be treated with antibiotics, and fungal infections can be treated with antifungal medicine. Immunosuppressants may be recommended if the patient is among the few people who do not respond to other treatments. Immunosuppressants work by controlling the immune system and disrupting the process of inflammation. If steroid treatment is causing significant side effects, immunosuppressants can also be used to allow your dose of steroids to be reduced. In some cases, an operation called a vitrectomy may be needed. It's usually only recommended if you have repeated or severe uveitis or if the condition is caused by certain infections. Thank you for your attention.